questions about coronavirus. New numbers out today show Washington has more than 8,300 confirmed cases and Oregon has about 1,200. In the 3 weeks since we started this show, you've sent so many questions about how the virus is spread. And joining us live tonight is a guest who spent a lot of time studying how COVID-19 spreads through the air. Dean Richard Corsi is a dean at Portland State University and an indoor air specialist. So, Dr. Corsi, you've warned 6 feet of social distancing isn't enough. Why?
It's an antiquated rule, and it's based on a flawed model. What we know now is a lot more than we knew in the 1930s or 1940s when those types of rules were developed. And if I can just take a moment and explain why, I think it's very important for the public to understand this.
Of course. When
you breathe, particles come out of your mouth. When you breathe heavily when you're exercising, particles come out of your mouth. When you speak loudly, even more particles come out of your mouth. And certainly when you cough, literally tens of thousands to hundreds of thousands of particles come out of your mouth just in one cough. And those particles are made up of mucus and saliva, largely, and have viruses that can be embedded within the mucus and saliva in the particle. The large particles that come out of your mouth are things that you can actually see. You know, sometimes you'll see a little piece of spittle come out of somebody's mouth when you're across the table from them. Those are the largest size particles that come out when you cough or something like that. Those particles, it's been assumed that those particles will drop out within about 6 feet. There's been a lot of research that shows that's not necessarily true in some circumstances. Even those large particles you can travel up to 20 feet. And then the preponderance of particles that come out of our mouths when we cough or we speak are really small particles that are literally 1/100th to 1/200th of the size of a diameter of a human hair. And those particles will stay suspended in air. They don't drop out very easily. And again, they make up the largest number of particles that come out of your mouth. So if you're in an indoor environment, for example, and somebody's infected and they're shedding viruses, those particles will accumulate and viruses will accumulate in the indoor environment. You can have somebody who's infected downstairs and those droplets and the viruses will spread all the way through the house to the upstairs environment. And you can become infected that way. So the 6-foot rule is flawed even for the large particles, which it was initially intended for. And it doesn't take into account these very small particles that can stay in air for very long periods of time and accumulate in indoor environments.
Based on that information, I mean, what is the best way to protect yourself then if you have to go out, for example, to the grocery store or the pharmacy?
So if you're going to the grocery store or the pharmacy, I think there's several things you can do. The first is social distancing. It's to stay as far away from people as possible. Remember, there's nothing magical about 6 feet. It's better to be 10 feet, 12 feet, 15 feet, 20 feet away if you can. The other is to essentially minimize your time in the space. Know what you're going in for, get it, and get out. Wear a mask. That can help to some extent, certainly with the large particles and to some extent with the smaller particles. Take all the other precautions you've heard people talk about when you bring things home. Wash your hands, make sure not to touch your face. And I think for those who own grocery stores or buildings that grocery stores are in and pharmacies, I would ask them to really consider to ventilate their buildings more, to increase the outdoor air supply rates in the buildings, to basically dilute the particles that are in air that contain viruses.
Okay, and we are in for a beautiful stretch of weather right now. Should people be wearing masks walking in the neighborhood or jogging or exercising?
That's a great question. Masks do several things. One is that they remind people of how dangerous it is out there right now. They can be detractors. So if somebody sees you wearing a mask, they may not want to get too close to you. They can protect others if you're asymptomatic and infected and you don't know it. So if you cough, the mask will reduce the amount of particles that come out of your mouth to some extent, and they can protect you to some extent. I think that social distancing is really important when you're outside. I think it's more important to keep significant distances from people while you're outside than it is to wear a mask. But wearing a mask gives you a little bit more protection, especially from the large droplets. So if you want to be super cautious, do both. Social distance, wear a mask. And just because you're wearing a mask, understand that doesn't give you full protection. So don't let your guard down and think you can get closer to people and somehow be protected.
Right. So, you know, like you said, social distancing, not 6 feet as far as you can. But before I let you go, can you please, we've gotten so many questions about masks. And can you please explain why wearing a cloth mask is good to protect others, but not yourself from getting coronavirus?
Well, it does both, actually. So the big deal with cloth masks for yourself is that if somebody is infected and they get too close to you, which hopefully you're going to avoid, and a large droplet comes out of their mouth, and the mask will protect your face from having that large droplet deposit on your face, and then you touch your face and bad things happen, or going directly into your eyes or mouth or nose, which is even worse. So they protect you pretty good from large droplets. If you have a mask that fits well and is made of the right material, the right, thick cloth material that tends to be a little bit more fibrous, and it fits well, you might get as much as 50% effective reduction in exposure to even small droplets. But that is just the right conditions where it fits well. Many masks that people make don't fit very well. There's openings around the nose especially, and when you breathe in, air can just go basically in through those cracks into your breathing zone as opposed to through the mask. If you're wearing a mask and you cough or you're speaking or breathing heavily while you're exercising, and the particles that you'd be emitting normally, many of those will be captured by the mask, and so you're protecting those around you. Again, the smaller particles are harder to collect in that mask that are coming out of your mouth than the bigger particles. But in either case, it does provide some protection. It's just not complete protection.
All right, great. Dr. Corsi, thank you so much for joining us. Great information. We really appreciate it.
Thank you.
And our next question has to do with pets after the news that a tiger at the Bronx Zoo tested positive for the virus. How can you keep your pet safe? Well, Keely Chalmers talked to the experts.
Yeah, here at the zoo, protocol has certainly changed. Staff members are now practicing social distancing with more animals. Before, they were just keeping their distance and wearing masks around the primates. Now they're doing that with almost all the mammals here. As for our pets, I also talked to an expert about that one, and she said we should basically be following the same guidelines that we should have been following over the last several weeks. If we feel sick, we should keep our distance, keep away from our pets, resist the urge to hug or kiss them. Because while the risk is extremely low, there is a chance we could give the virus to our pets. On the other hand, that expert told me there is absolutely no risk, no chance of our pets giving the virus to us. Now, she also pointed out if you think your pet is sick, don't just take it into the vet. Call ahead of time. That's because if your pet is sick, there's a good chance you're sick. And if you head straight to the vet's office, you'd just be exposing everyone there.
Great information from Keely. Thank you. And at any time you can send us your questions. The number is on your screen, 503-226-5111. If we don't get to your question tonight, we'll be answering questions right here at 7 o'clock, Monday through Thursday. And how about up next? You wanted to know if the virus is mutating. We have the answer. But first, a viewer question. You wanted to know, what is a homemade solution that you can make to disinfect surfaces? The answer, the CDC recommends a bleach solution with 5 tablespoons of bleach per. Next question is an interesting one. This person says, my hair salon is reopening and making appointments starting April 16th. Are they able to do that under Governor Brown's order? When can businesses start reopening under the existing executive order? Okay, so according to the rules set by the governor, grooming businesses, including salons, they should be closed right now. And Governor Brown has said that she wants to wait to lift the order when we have 10 days of no deaths. So no, this business should not be opening April 16th. Next question. I've been reading articles about this COVID-19 mutating. They say that scientists have discovered other versions of COVID-19 that have mutated already. Is this true? Thank you, Leah, for that question. So while the flu virus is a superstar at mutating away from our immune protection, Fortunately, doctors say this virus is not. They say that the RNA structure and the proteins it codes for appear to be very stable. That means it's very likely that a vaccine we develop in the months to come and distribute 12 to 18 months from now will still be effective. Please keep sending in those questions. We do our very best to answer them. And if you have a question that we did not answer right now, go to kgw.com/answers and you can see all the questions that we've answered so far. Up next, will you have to pay taxes on the stimulus check? Our Verify team has the answer. But first, a question from Vicky in Vancouver. Vicky, thank you for the question. She wanted to know, can COVID-19 live on money? The answer, it is possible the virus could stay active on coins and paper bill. You should wash your hands after handling money. Some health experts have recommended using cards, but welcome back to KGW Q&A. You should be getting your federal stimulus payment soon, and some of you have been asking if you'll have to pay that money back or pay taxes on it. Here's Jason Puckett.
Viewer Lindy Horowitz sent us this question. Quote, is the stimulus check in advance for taxes 2020? We've also received a number of emails wondering if you have to pay taxes on the stimulus checks. So that's what we're verifying. Are the stimulus checks in advance of credit for 2020 taxes, and do you have to pay taxes on them? Our sources are the CARES Act itself and the IRS and U.S. Department of Treasury, along with documentation from Senator Dianne Feinstein. So quick recap. The CARES Act, which passed in late March, includes stimulus money for multiple businesses and a large chunk to help American taxpayers. The bill uses your 2018 or 2019 tax returns to determine if you qualify for a payment based on your income. It basically boils down to this. Adults who filed taxes get $1,200 each, and their qualifying children get $500. If your adjusted gross income is over $75,000 individually, or $150,000 for joint filings, the amount of that credit decreases up until $99,000 for an individual and $198,000 for a joint filing. Past that, no checks. Okay, so those are the numbers. The big question though, are we going to have to pay that back? No. The Act itself calls these a, quote, advance refund. That's a tax credit they're paying you now. This credit will come into play when you file your taxes in 2020. If you're eligible for a refund based on your tax return, the stimulus credit you received would be deducted from that amount. If your refund is less than the credit or you owe money, you won't be required to pay that back. So yes, we can verify the checks are an advance credit on our 2020 taxes. The government is essentially giving us refunds for the taxes we will pay in 2020. And since it's money from our taxes, you don't have to pay it back. The government's providing an early refund here. Senator Feinstein's office also confirmed that since it's a tax credit, we don't pay additional taxes on the money. If you've got more questions like this, send us an email. With your Verify, I'm Jason Puckett.
Another money question, how is the loan process for small businesses? Banks have started taking applications, but there have been a lot of headaches. NBC business correspondent Jo Ling Kent has an update on the process.
Well, billions of dollars have been applied for through the major banks now, but the issue is getting that money dispersed. So you have a problem on the application side, and the disbursement is taking a lot of time. Systems are down, they're not working properly. And so as much as the Trump administration is saying, yes, we are providing this small business assistance and support to get people back on their feet, that isn't necessarily the case when it comes to getting that money quickly. So there's a lot of pressure on both the administration and the banks to figure out what the issues are and get the money out there. But so many small businesses we've been talking to over the past, month and a half are all saying that they have rent due, they have mortgages and loans, they need to pay their workers if they're going to keep them on the payroll, if they haven't laid them off already, and they're in a really, really tough spot. And you have to remember that small businesses make up the backbone of our country. 99.9% of businesses are small businesses.
Right, this affects so many people, and you've asked a lot of questions about the long-term impacts. What does the crisis mean for the economy? Lindsay Nadrich has answers from local experts.
I know a lot of us hope the economy will recover quickly as the stay-home orders are lifted and businesses start to reopen. But economists say it could take a year until we're back to where we were before this. I spoke to the president of Echo Northwest. I asked him, what does the big picture look like for Oregon as we go through this unprecedented shutdown? And he told me to look at it like 3 chapters. The first, obviously, is the shutdown period that we're in right now. That could go through May, possibly until mid-June. He says next will come this period he calls the reopening. That's where businesses will start to reopen, but people will be unsure of what's safe and what's not. We're seeing that happen right now in China, where restaurants are open, but people are still scared to leave their homes. Finally, he said we'll get to a point he calls true recovery, but that won't happen likely until June of 2021. So unfortunately, it could take a while for things to get back to normal.
All right, Lindsay, thank you. Up next, this is a question we've gotten a lot. We'll answer how baristas are being kept safe as they serve in drive-thrus. But first, you wanted to know, how do I maintain a positive attitude when I'm cooped up in the same surroundings day after day, week after week, and now month after month? Here's an answer we got from Lines for Life. They suggest 3 things. Stick to your routine, move, whether it's a walk around the block or yoga class in your house, and connect with friends on FaceTime. Welcome back to KGW Q&A. You know, coffee drive-thrus are allowed to be open under the governor's order. Many of you have asked, how are staff staying safe at Dutch Bros? Some are worried they're still open after an employee in Monmouth tested positive for COVID-19. Well, Dutch Bros paid staff who had contact to stay home and self-isolate. KGW's Galen Etlin tells us what else they're doing.
Dutch Bros is by far the one you've asked us the most about. It tells us there's new distancing requirements and no more of its trademark friendly high fives. Employees are required to wash hands and sanitize workstations multiple times during shifts. Gloves are available, and we're told masks are on the way too. Now, as a customer, there's a cashless system, and any touchpad used gets cleaned right after. Anyone not following these new rules is supposed to be reported to management.
All right, great info. Thank you, Galen. Now, we'll finish tonight with a common concern for parents. How can we help kids cope with the pandemic? Dr. Christine Barrett has suggestions.
Empower children to feel like there's something they can do. They can wash their hands. They can keep space. They can actually, organize their day so it's creative and growth enhancing and develop increased emotional resilience themselves. We continue to talk about that it's going to be different, but that doesn't mean it has to be bad.
Dr. Barrett says the most important thing you can do is have conversations with your kids often, and before bedtime is a great time. Thank you for joining us tonight. KGW is committed to continuing our coverage on the coronavirus outbreak and answering your questions. You can go to kgw.com/answers to see all of our past Q&As. We may have already answered your question, and we'll see you back here tonight.